Institute Cardio-Oncology program has created access to much-needed cardiovascular care to cancer patients. 5 years after its launch, the program has received a Center of Excellence certification from the International Cardio-Oncology Society at the gold level, the highest award the organization can give. Joining us today is Dr. Eric Oligino, a cardiologist with the Hartford HealthCare Heart and Vascular Institute, who runs the Cardio-Oncology program. Doctor, welcome.
Thank you for having me.
So tell us more about this program.
So cardio-oncology is a subspecialty of cardiology that really addresses the needs of cancer patients before, during, and after treatment. What makes our program so unique is that it's system-wide. So Hartford HealthCare has a very expansive footprint, but it was important for us to make sure that we could deliver this subspecialty care locally where the patients live and where they receive their oncologic care.
Okay, tell us about why a patient would be referred to the cardio-oncology program.
Absolutely. So despite the tremendous progress that's been made in cancer therapies, certain therapies can directly impact the heart and have direct toxicities, and other therapies can worsen cardiac risk factors such as high blood pressure and high cholesterol. And then cancer patients oftentimes have underlying cardiac disease and risk factors that are often underdiagnosed and undertreated. Those are just some of the reasons why a patient might be referred to our program.
All right, and doctor, talk about why cardiac health is so important to a patient's survival.
So when a patient gets diagnosed and treated for cancer, they have real fears about cancer recurrence and death. But really, for a lot of cancers, after the patients are about 2 to 3 years out from their cancer treatment, the number one killer of cancer patients is actually heart disease. So that's why it's critically important that we optimize their cardiovascular health during the treatment phase and through survivorship, because more and more patients are surviving their cancer every day.
That's an amazing statistic. I never would have thought that. All right, you're 5 years into your program. Tell us about the significance of your certification.
Simply put, it means that we deliver outstanding care as objectively assessed by international leaders of the field. So to apply for this certification, our program was rigorously assessed for its clinical expertise, its programmatic development, its quality improvement initiatives, research, and education. And after that assessment, we were recognized with this Gold Certificate of Excellence, which is the highest designation offered by the International Cardio-Oncology Society.
All right, and doctor, tell us, what do you see as the future? Is this an exciting time in the field that you're in?
Absolutely. The future is really just more growth. We need to increase awareness, just like we're doing now, so that patients and providers know that even though when a patient gets diagnosed with cancer, a lot of times everything else stops. But you have to make sure that you optimize your cardiovascular health, and don't forget about that, so that the current cancer patient doesn't become the future heart patient.
All right, Dr. Eric Oligino with the Hartford Heart and Vascular Institute with Hartford HealthCare. Thank you very much. Very interesting. We appreciate your time.
Thank you so much for